Good morning, ma'am. Good morning, everyone. My name is Judian L. Abalos and nasa chapter 6 na tayo ng lesson natin, which is yung somatic symptom and related disorders and dissociative disorder. So, dito kay somatic symptom, there are 5 disorders na madidiscuss, which is si somatic symptom disorder, pangalawa is si illness anxiety disorder, pangatlo is si psychological factors affecting medical condition, fourth is the conversion disorder, and lastly, factitious disorder. So, ang matatakal natin is si somatic symptom disorder and illness anxiety disorder. So, let's begin muna kay SSD. Somatic symptom disorder is also called somatoform or somatization disorder, wherein combination siya ng mga somatic symptoms or physical symptoms because soma means body. So, these are the physical symptoms na nararanasan ng isang individual na nakakapagpa-distress sa kanila. Physical symptoms na nagkakaroon sila ng excessive thoughts, feelings, and behavior. Diba kapag ang isang bagay ay nakakapagpa-distress sa atin, nagkakaroon tayo ng excessive response. So, ganun din sa mga taong may mga gantong klase ng disorder. Apektado yung everyday functioning nila. Unti-unting nawawala yung sigla nila sa mga bagay-bagay because of their excessive thoughts, feelings, and behavior dun sa mga physical symptoms na nararanasan nila, which causes them to be distressed. First thing here is kapag nagpa-consult sila sa isang healthcare professional, hindi agad sila nabibigyan ng proper diagnosis sa complaint nila because their physical symptoms was medically unexplained. Hindi agad na-identify ng isang healthcare professional kung ano ba yung medical cause, kung saan ba nagsimula yung physical pain. And to give us an awareness lang para dun sa mga taong nakakaranas ng gantong klase ng disorders, that their emotions or reactions are valid sa mga somatic symptoms or physical symptoms na nararanasan nila. Hindi nila ginagawa yon para magpapansin or humingi ng atensyon sa ibang tao. In fact, sila nga yung lumalayo sa mga taong nakapaligid sa kanila. Kasi feeling nila walang makakaintindi sa sitwasyon na pinagdadaanan nila. Kasi 'di ba, commonly yung mga nararanasan ng mga taong may gantong klase ng disorder is yung mga physical pain na nararanasan din ng mga normal people, ng mga normal individual katulad natin. Nagkakaroon din tayo ng mga physical pain, headaches na para sa atin normal lang. Ganon. Pero sa mga tao kasi na may somatic symptom disorder na iba yung tingin nila kapag nakaranas sila or nakaramdam sila ng mga somatic symptoms. At para mas maintindihan natin si somatic symptom disorder, may ipapanood ako sa inyong video which is case to ni Anna and ni Matthew. Si Anna ay isang 16-year-old and si Matthew naman ay 11 years old. So, yung video na to is kinat ko na lang dahil time consuming kapag pinanood ko siya sa inyo ng buo. Pero, ibibigay na lang din namin sa inyo yung link kung gusto nyo siyang mapanood ng buo.
I know it's hard to look back, but your story might be helpful to others.
Basically, if I think back, it started with these like crazy headaches, which was weird because I'd never had headaches before.
Before, it used to happen like 50 times a day. That's why the principal told me I couldn't come to school anymore.
Can you tell me what your first visits to the doctors were like?
I was going to a lot of appointments, and I went to emergency a bunch of times.
They like sent me for a bunch of tests and like CAT scans and stuff.
And what did they say?
They all said it was something different. One doctor said it was a sinus infection.
I was really confused as to why I was sick.
I knew my parents were really worried that it was something bad. Scared.
Scared of what?
Maybe might die or something.
What was your life like at that time?
Like the way I see it, my life kind of stopped when I was sick. All I wanted to do was be in a dark room 24/7. Like another thing that I had to accept was that life was gonna go on without me. You know, my friends were gonna keep going to parties and going to movies together, and they were gonna continue to hang out even if I wasn't there.
And what about your family?
My family sympathized with me, but it was really hard to connect with them at that time because no one had been through something like that before. It's not like a cast on your arm that can show people what's wrong. When it's in your head, how are they supposed to know when you're in pain? And so you have to communicate that with them, but sometimes your words just don't work. So, I don't know, I kind of felt like nobody really got what I was feeling.
According to sa video, si Anna and si Matthew ay parehong nakakaranas ng somatic symptom disorder. Si Anna ay nakaka-experience ng chronic headaches, which is hindi niya alam kung paano nagsimula, kung saan nagsimula, bakit niya nararanasan yung ganong klaseng physical pain. And ayun yung naging cause para dumistansya siya sa mga taong nasa paligid niya. Kasi feeling niya walang makakaintindi sa kanya kasi siya nga mismo hindi niya maintindihan yung sarili niya kung bakit niya nararanasan yung ganong klaseng physical pain. So, feeling niya kapag kwento niya pa yung nararanasan niya sa mga kaibigan niya is or sa family niya is hindi rin siya maiintindihan. And as well as Matthew, they've undergo from different consultations and tests, and still at the end of the day, wala silang makuhang matinong resulta galing dun sa doctor. Just like I said earlier, the somatoform is the expression of physical symptoms na nagkakos ng psychological stress sa isang individual. Physical symptoms kagaya ng, of course, physical pain, nausea, feeling of dizziness, fainting, and unusual movements. Diba lahat naman tayo kapag ka-stress is nagkakaroon tayo ng physical expression dun sa bagay na nakakapagpa-stress sa atin. And it's normal, diba? Normal lang na ma-stress tayo. Minsan nga, kapag ka-stress tayo yung lumalayo sa mga taong nakapaligid sa atin. Ayaw natin kumausap ng kahit sino. Gusto natin mapag-isa lang. Gusto natin tahimik lang. So, best example na may bibigay ko sa inyo is siguro mga panahong may pasok pa. Ayan. So, magbalik tanaw muna tayo ng mga panahong nakakasama pa natin yung mga kaklase natin. Ayan. So, sabihin na lang natin yung grupo nila A. So, sila yung grupo na good vibes lang, chill lang, masaya lang kapag magkakasama sila. Then the next day, may isang tropa sila doon na gusto niyang mapag-isa lang. Ayaw niyang makipagsabayan sa trip ng tropa. Then kapag bababa yung tropa para pumuntang kantin, siya hindi sasama, makikisabay lang siya para magpabili ng pagkain, ganyan, magpapaiwan lang siya sa classroom. Then the next day, kung pumasok yung tropa nila na yun, okay na ulit siya, masigla na ulit, nakikipagsabayan na ulit siya sa trip ng tropa. And kung mapapansin nyo, diba, normal lang siya sa atin. And ayun yung tinatawag nating mind-body connection, wherein kung ano yung iniisip natin, kung ano yung nararamdaman natin, na-express natin yun physically. Pero kapag yung tropa nila na yun ay nag-continuous yung ganong klase niyang behavior, wherein madalang na kung makipag-usap siya sa tropa niya, madalang na kung sumama siya sa mga gimmick ng tropa, ganyan. At kapag naapektuhan na yung everyday activities ng tropa nila na yon, may possibility na baka yung tropa nila na yon ay nakakaranas na pala ng isang klase ng disorder. Another example na maipe-present ko sa inyo about SSD is yung case ni Linda. So yung case na to is nakuha ko lang din sa book na gamit natin ngayon. In Linda's case, ang kina-complain niya is that hirap siyang huminga and meron ding pamamaga sa joints niya, both legs and arms. She also had a chronic urinary tract infections or yung tinatawag nating UTI na common na nararanasan ng mga kababaihan. And ito yung naging main reason niya para magpa-check up kasi nakaka-apekto na siya sa everyday functioning. Like sa work niya, dahil sa mga physical symptoms na nararamdaman niya, hindi niya mabigay yung 100% best niya sa trabaho. And pagdating doon, may mga sinagutan siyang medical diagnostic test para malaman on how they'll properly diagnose her condition. After niya magsagot, Linda felt na meron siyang mga chronic infections na walang proper diagnosis. And nagsimula yung ganito niyang problema during her hospital training. Napansin niyang lumalala yung physical conditions niya, which is naging paralyzed yung mga binti niya, na nag-cause sa kanya ng emotional stress, and dahil doon, di niya na tinapos yung pagiging nursing or yung pag-nursing niya. And nagpa-admit na siya sa isang psychiatric hospital. The good news is that after a year, she regained her ability to walk. So, bakit kinonsider na may somatic symptom disorder si Linda? It is because she met all the DSM-5 criteria for SSD. She was severely impaired and had suffered in the past from being paralyzed. Tandaan natin na yung may mga gantong disorder is that they continually feel weak and ill. Wala silang energy para makihalubilo sa iba, and even exercise, iniiwasan nila, thinking na it will worsen their condition. Dumadating pa nga sa point na yung mga kagaya ni Linda, they lose their sense of reality kung hindi sila open sa kung ano yung nararamdaman nila. That's why it would be better for the people na merong gantong disorder na maging open, especially to their loved ones, relatives, friends, and therapists, because those are the people who will help them. Yan. So, merong diagnostic criteria for somatic symptom disorders. So, ito yung magiging basis para masabi na ang isang individual na pala na ito ay nakakaranas na ng somatic symptom disorder. So, una, one or more somatic symptoms that are distressing at nagre-result siya para maapektuhan na yung daily life ng isang individual. Pangalawa, kagaya ng sabi ko kanina, kapag meron ng excessive thoughts, feelings, and behaviors ang isang individual dun sa nararanasan niyang somatic symptoms or physical symptoms, ay baka may possibility na meron na siyang somatic symptom disorder. And it is manifested by at least one of the following. Una, disproportionate and persistent thoughts. Kumbaga, hindi na maalis sa kanila na baka hindi lang ito yung ordinaryong physical pain na nararanasan ko. Baka meron na pala akong serious illness kaya ako nararanasan yung gantong klase ng somatic symptoms. Pangalawa, high level of health-related anxiety. Yun bang kapag nakaranas siya ng ibang physical symptoms, nagte-trigger yun para mas lalo siyang mag-worry on the possibility of having a serious illness. Pangatlo is excessive time and energy devoted to these symptoms or health concerns. Yun bang hindi sila tumitigil maghanap ng accurate explanation or result dun sa nararamdaman nila. Kaya may iba sa kanila na every now and then talaga kung magpa-consult complaining on their physical symptoms. And so lastly, although any one symptom may not be continuously present, the state of being symptomatic is persistent. Yun bang every now and then nararanasan nila yung physical symptoms na yon, and it can last up to 6 months. Proceed naman tayo kay illness anxiety disorder, which was formerly known as hypochondriasis. So, si somatic symptom disorder and si illness anxiety disorder ay mayroong pagkakapareha. So, si illness anxiety disorder, these are the individuals who tend to believe that they have a serious disease or illness. So, it is characterized by high illness anxiety that causes them to be distressed to the point na naapektuhan yung daily life nila. Mapa-work, school, or even sa bahay, hindi sila makapag-function normally because they are preoccupied with these fears of having or acquiring a serious illness. So, a person who have this kind of disorder is already preoccupied with fears. Takot na kapag nakaramdam sila ng gantong symptoms is magko-conclude agad sila na meron na silang serious illness. Ipapanood ako sa inyong short video ng isang individual na nakakaranas ng illness anxiety disorder.
If I have a brain tumor, I don't know what I'm gonna do.
Don't have a brain tumor. He didn't say you had a brain tumor.
No, naturally they're not gonna tell you because sometimes the weaker ones will panic if
But
you tell
not
them.
you.
Oh God, you're a buzzing. Is there a buzzing?
Mickey, come on, we got a show to do.
I can't keep my mind on the show.
But there's nothing wrong with you.
If there's nothing wrong with me, then why does he want me to come back for tests?
He has to rule out certain things.
Like what?
I don't know, cancer.
Don't say that. I don't want to hear that word. Don't mention that while I'm in the building.
But you don't have any symptoms.
I got the classic symptoms of a brain tumor.
2 months ago, you thought you had a malignant melanoma.
Naturally, the sudden appearance of a black spot on my back.
It was on your shirt.
How was I to know? Everyone was pointing back here.
As you watch the video, kung mapapansin nyo, yung reaction or yung behavior ng lalaki is nakafocus siya dun sa thought na baka meron na siyang serious illness, which is yung brain tumor, and halata sa behavior niya na mataas na yung level ng anxiety niya. Like, hindi na siya makapag-focus dun sa dapat nilang gagawin. And nabanggit din doon ng kasamahan niya na may iba pa siyang kinocomplain na mga symptoms. Yan. So, yung mga taong may gantong klase ng disorder is hindi sila satisfied sa nagiging findings sa kanila ng doctor nila. That's why they keep on searching and they keep on complaining from the different doctors about their symptoms. And kapag hindi sila na-satisfied dun sa findings ng doctor sa kanila, is maghahanap sila ulit, magpapakonsult ulit sila sa isang specialist hanggang sa makuha nila yung result na gusto nilang makuha. Another example na may bibigay ko sa inyo about illness anxiety disorder is yung case ni Linda, which is kinuha ko lang din siya sa book na gamit natin. In Gail's case, kung mapapansin nyo, she is more concerned on having a serious illness. There are some factors na nabanggit para mag-deteriorate yung nararamdaman niya. Una, she is belong in a lower middle class household. Pakiramdam niya lagi siyang nangihina, walang enough energy para magpatuloy on what she used to be. She also felt neglected ng mga taong nasa paligid niya. Dagdagan pa ng low self-esteem. So, 'di ba, dito pa lang sa point na to, kung ilalagay natin yung sarili natin sa position ni Gail, there's a possibility na maranasan din natin yung case niya. Turning back to her case, dahil nga hindi niya maramdaman yung self-worth niya and hindi niya na makontrol yung mga nararanasan niya, she concluded that maybe marriage would solve everything. Pero hindi yun nung nangyari. After niyang malaman na her husband was continuing an affair. So years passed after her wedding, she came to a clinic complaining of stress and anxiety. Stress hindi lang dahil sa husband niya, but she also found her job extremely stressful. And even na nagbago na yung asawa niya, nandun pa rin yung thought na baka gawin ulit yon sa kanya. And naging major concern niya is about health, na anytime na makaka-experience siya ng physical symptoms such as headache or hirap sa paghinga, she had that fear na baka may malala na siyang sakit. Like kapag nakaramdam siya ng headache, iisipin niya na baka meron na siyang brain tumor or what. Takot din siyang matulog sa takot na baka hindi na siya magising. And even yung mga physical activities, iniiwasan niya, thinking na it will deteriorate her condition. Now, lagi siyang nakafocus dun sa mga symptoms na pwedeng mag-trigger ng anxiety niya. She spent more of her time on dealing with her conditions dahil hindi siya satisfied sa mga findings sa kanya. Pakiramdam niya, she had a serious illness that nobody could treat. Dahil every time na magpapakonsult siya sa isang specialist, iisa lang yung nagiging findings nila, that Gail is perfectly healthy. Kung merong criteria for somatic symptom disorder, meron din kay illness anxiety disorder. So, una, preoccupation with fears, in which the focus of the fear and worry is on uncomfortable or unusual physical sensations on having a serious medical condition. Pangalawa, somatic symptoms are not present. Kumbaga, hindi siya ganong binibigyang pansin dito sa illness anxiety disorder kasi ang isang individual is much more focused on the possibility of having a serious illness. Next is, there is a high level of anxiety. Like for example, may mabasa lang silang article about dun sa condition nila, ganyan. So, best example nito is yung short video na pinanood ko sa inyo kanina. So, wherein yung patient dun is tumaas yung level ng anxiety niya nung malaman niyang pinapabalik siya ng doktor niya sa clinic. So, diba dun pa lang, hindi niya na makontrol yung level ng anxiety niya. Ang dami na agad pumasok sa isip niya ng mga possibilities on having a serious illness. Next criteria is the individual performs excessive health-related behaviors. Maaring sila yung mga taong frequently chine-check yung heartbeat nila or kung may bago ba silang nararamdaman na symptoms. Sila rin yung mga taong takot lumabas ng bahay, takot gumamit ng mga public transportations or public restrooms, thinking na it will get their condition worse. Proceed naman tayo sa clinical descriptions ng dalawang case na present natin, which is yung case ni Linda and yung case ni Gail. So, kung mapapansin nyo, there's a difference between the two cases. Si Linda, yung kinocomplain niya is more on her physical symptoms, while si Gail naman, she is less concerned with any physical symptoms. She is more worried than about the idea that she was either ill or having a serious disease. So, according to research, illness anxiety disorder and somatic symptom disorder share many features with anxiety and mood disorders, particularly yung tinatawag nating panic disorder. So, itong si anxiety and mood disorder ay nag-i-exist din simultaneously kay SSD. That's why kapag ang isang tao na may SSD at meron pa siyang mga karagdagang diagnosis, kinoconsider nila ito as anxiety or mood disorder. Kaya tayo may tinatawag na illness anxiety disorder because it is characterized by anxiety or fear. And an individual with illness anxiety disorder is preoccupied with bodily symptoms na nami-misinterpret nila of having a serious disease. Any kind of physical sensation ay pwedeng maging basis and makadagdag sa anxiety level nila. So, such as yung heart rate, minimal or minor physical abnormality such as cough. That's why they always go initially to a healthcare professional and they continue to go to a multiple doctors whenever hindi sila nasasatisfied sa result. According to statistics naman, yung madalas na nakakaranas ng mga gantong klase ng disorder mostly are those from lower socioeconomic group, women, and unmarried. And also yung mga individual na meron na talagang inborn disabilities. So, ano-ano nga ba yung mga causes kung bakit nagkakaroon ng gantong klase ng disorder ang isang individual? So, this kind of disorders may develop in the context of stressful life event, kagaya ng child abuse. Baka naman kasi si patient nakaranas na ng pang-aabuso bago siya magkaroon ng disorder. Pangalawa, serious childhood illness or parent with a serious illness. So, baka kasi si patient ay may history na talaga ng serious illness or kung hindi man siya, pwedeng yung mga magulang niya nagkaroon na ng malalang sakit before. Na in the present, kapag nakaramdam ulit si patient ng symptoms, tumataas agad yung level ng anxiety niya. Lastly, beliefs. Baka si patient is having a hard time tolerating uncertainty over uncomfortable body sensations. Kasi kung ganon, pwede niyang ma-misinterpret that all body sensations are serious and can lead to a serious disease. Lastly, at ang pinaka-importante sa lahat is the treatment process. So, kaya po tayo may treatment process sa mga gantong klase ng disorder ay para matulungan natin yung isang individual na ma-manage yung stress nila about their health and to improve their ability to function in daily life. So, si psychotherapy, particularly cognitive behavioral therapy or treatment, can be an effective behavioral treatment. So, bakit nga ba napaka-importante ni cognitive behavioral treatment sa mga gantong klase ng disorder? Because CBT can help the patient to identify their fears and beliefs about having a serious medical disease. Second, it helps them to become more aware of how worries affect them and their behavior. Pangatlo, it changed the way they respond to their body sensations and symptoms. Lastly, nakakatulong din si CBT para maibalik ni patient yung communication niya sa mga taong nasa paligid niya. Binibigyan din si patient ng mga antidepressants or yung mga medicines na pwede niyang i-take para mabawasan yung mga excessive response niya every time na makakaramdam siya ng mga physical symptoms. That's all, guys. Thank you so much for listening. I hope that you've learned something on our discussion today. So, thank you po.